Hi, this is Dr. Ilan Simckes at Fertility Partnership. Happy July 2019. We've just finished one of our biggest cycles we've ever had, June. Hoping those results will be as good as May. So, decided to come to you again to talk to you about a topic that's dear to my heart, and that is how to get started in the infertility process. How do you know you're infertile? How do you know there's a problem? And really today I want to talk about how to make sense of the mess. You know, you find Mr. Perfect, you find Mrs. Perfect, you get married, you bring home flowers, she cooks you dinner, and then the babies aren't coming. So you guilt, oh my God, maybe my sperm isn't okay. I'm speaking in the male personal form for obvious reasons. As a woman, you wonder, oh my God, are my eggs any good? Is something wrong? And guilt and fear and concern. So you need to have a roadmap. You need to have something to really help you focus and keep yourself together. I came up with an acronym, S.E.M.S, T.M. SEMS stands for sperm, eggs, can they meet and can they stick? Something I came up with a while back to help train residents and medical students. Patients come in all the time and saying they're having trouble getting pregnant, and they get Clomid thrown at them, or they're told to disappear try again for another year. I think anybody, any couple who believes they have an issue can start thinking in the S.E.M.S way. This encompasses probably 95% or more of all the issues that we're going to have to deal with. So, sperm. I always start with a semen analysis. Why? I mean, would you make a 1,000-mile drive in your car without checking the tires and the oil? Of course. You have to make sure that there are soldiers. So many stories I could tell you about situations where we or someone else failed to actually do the semen analysis, and then you end up looking pretty stupid. You have to do it. And if the male in the partner doesn't want to do it, we have to figure out why. Always start with a semen analysis, always. Number 2, eggs. What does that mean? Well, it's the egg supply, but it's also your ability to ovulate. So egg supply is easily tested with a blood test and an ultrasound. Antral follicle count, AFC, look it up. And then there's a blood test for AMH, anti-Mullerian hormone. Do you ovulate? The only way to know you ovulate is you get pregnant. Everything else, temperatures and tests. We want to see a regular cycle and some pain and mucus, but you really don't know until we get a pregnancy. Can they meet? That means that starts down in the vagina. Is sperm being deposited, sexual dysfunction, all the way is your cervix ruined by bad pap smears and having your cervix frozen, to polyps, to fibroids, to are your tubes damaged, all the way out into the peritoneal cavity where your ovaries are. Is there endometriosis or scar tissue? Can they meet? Very important. Last but not least, something that is often overlooked is can they stick? People don't realize that 85% of all human pregnancies end in miscarriage, and the overwhelming majority of them go undetected. The woman never knew she was pregnant. Period came a day early, day late, breasts were sore. But when they've monitored couples actively trying, they saw that 85% of the pregnancies never make it. So that means some people who are struggling to get pregnant really are getting pregnant, they just don't know it. And if you don't think about it, you'll miss the diagnosis. So these are things. Here at Fertility Partnership, we start battling miscarriages from day 1. We start giving you supplements, and we start investigating that, because that's the hidden 5th column. That's what's hiding in the background. S.E.M.S, if you follow this and keep this in the back of your mind, you won't get lost. It's easy to get lost in the weeds, to not see the forest because of the trees when you're stuck in the misery of trying to have a baby. We love what we do here at Fertility Partnership, and we will do whatever we can to help you on your journey. We've gotten very good at it, and we also try not to overcharge you. You're welcome to give us a call, 636-441-7770. You can email me with any questions you might have about SEMS. Peace out.